Hello, future nursing professionals. Welcome to our channel, Canadian Nurse Expert. Congratulations on taking this exciting step towards your dream career. Passing the NCLEX RN examination is a significant milestone on your journey to becoming a licensed registered nurse. This comprehensive syllabus guide is meticulously crafted to equip you with the knowledge and strategies needed to conquer the NCLEX RN 2025. The NCLEX RN exam is renowned for its rigor, designed to assess your competency in providing safe and effective nursing care. As you know, nursing is a dynamic field that constantly evolves to incorporate the latest advancements in healthcare. In alignment with this evolution, the NCLEX RN exam itself is undergoing a significant transformation in 2025. The National Council of State Boards of Nursing, NCSBN, has introduced the Next Generation NCLEX, NGN, marking a paradigm shift in nursing licensure examinations. The NGN goes beyond simply testing your recall of facts and figures. It delves into evaluating your clinical judgment, your ability to think critically, analyze complex patient scenarios, and make sound nursing decisions that ensure optimal patient outcomes. This syllabus guide will serve as your roadmap to navigate the intricacies of the NCLEX RN 2025, providing a clear breakdown of the exam's content, format, and essential study domains. We will delve into the innovative Clinical Judgment Measurement Model, CJMM, that underpins the NGN, equipping you with the knowledge and skills to excel in this new testing landscape. Let's embark on this journey together. The NCLEX RN 2025, with its emphasis on clinical judgment, reflects the evolving healthcare landscape and the increasing complexity of patient care. No longer is it sufficient to simply memorize facts and procedures. The NGN demands that you demonstrate a deep understanding of the nursing process and the ability to apply your knowledge in real-world scenarios. Imagine yourself faced with a critically ill patient presenting with a myriad of symptoms. You'll need to swiftly assess the situation, prioritize interventions, and make informed decisions that could potentially save a life. This is the essence of clinical judgment, the ability to think on your feet, adapt to changing circumstances, and provide safe, effective, and compassionate care. The NGN utilizes a variety of innovative item formats to assess your clinical judgment. Gone are the days of relying solely on multiple-choice questions. Be prepared to encounter case-based scenarios that simulate real-life clinical situations. You'll be required to analyze patient data, identify potential complications, and make critical decisions based on your assessment. But fear not, aspiring nurses. This syllabus guide will provide you with a comprehensive overview of these new item formats, including Bowtie and trend questions, equipping you with the strategies and confidence to tackle them head-on. Embrace the evolution of the NCLEX as an opportunity to showcase your critical thinking skills and demonstrate your readiness to excel as a competent and compassionate registered nurse. At the core of the Next Generation NCLEX NGN lies the Clinical Judgment Measurement Model, CJMM, a framework meticulously designed to evaluate your ability to think like a nurse and make sound clinical decisions. Imagine the CJMM as the engine driving the NGN, ensuring that it accurately assesses your readiness to provide safe and effective patient care. The CJMM outlines a systematic approach to clinical judgment, guiding you through a series of cognitive processes that nurses employ in real-world practice. It begins with recognizing cues, gathering and interpreting patient data from various sources, such as vital signs, laboratory results, and patient history. Think of this as the initial assessment phase, where you gather all the pieces of the puzzle. Next comes analyzing cues, where you delve deeper into the collected data, identifying patterns, and determining the relevance of each piece of information. Is the patient's blood pressure within normal limits? Are there any abnormal laboratory findings that raise red flags? This step requires critical thinking and the ability to differentiate between relevant and extraneous information. Once you've analyzed the cues, it's time to prioritize hypotheses, generating possible explanations for the patient's condition based on your assessment. This step involves drawing upon your nursing knowledge, pathophysiology, and clinical experience to formulate potential diagnoses or problems. For instance, if a patient presents with shortness of breath, potential hypotheses could include pneumonia, heart failure, or anxiety. Imagine stepping into a virtual hospital ward where you're presented with a realistic patient case. The patient's medical history unfolds before you, complete with vital signs, laboratory results, and medication lists. This is the essence of case-based scenarios, a cornerstone of the NGN designed to assess your clinical judgment in a dynamic and engaging manner. Case-based scenarios go beyond simply testing your recall of facts. They challenge you to think critically, analyze complex patient data, and make informed nursing decisions that mirror real-world practice. You'll be required to prioritize care, anticipate potential complications, and evaluate the effectiveness of interventions, all within the context of a specific patient case. Each case study on the NGN typically consists of 5 to 6 interconnected questions, each building upon the previous one. As you progress through the questions, you'll gather more information about the patient's condition, much like you would in a real clinical setting. This progressive unfolding of information requires you to adapt your thinking, adjust your care plan as needed, and demonstrate your ability to think on your feet. To excel in case-based scenarios, it's crucial to approach them strategically. Begin by thoroughly reviewing the patient's information, highlighting key data points. Then, carefully analyze each question, identifying the specific task or decision required. Remember to consider the patient's overall condition, potential complications, and the nursing process as you formulate your responses. Section 3. Navigating the labyrinth. Multiple response items. Multiple response items in the NGN enhance clinical judgment assessment. Select all that apply questions require selecting all accurate and relevant options. This demands keen attention to detail and critical thinking. Identify all plausible options and rule out inaccuracies. Mastering this requires a systematic approach. Carefully read the question and analyze each option. Be thorough and precise in your selections. Section 4. Embracing innovation, Bowtie, and trend questions. The Next Generation NCLEX (NGN) introduces innovative item formats to challenge your clinical judgment. Bowtie and trend questions assess your ability to analyze relationships and interpret patterns. Bowtie questions resemble a bow tie, presenting opposing concepts to identify decision factors. Trend questions focus on interpreting patterns and changes in patient data over time. Embrace a strategic approach to tackle these questions effectively. Section 5. Integrating knowledge and application, the key to success. The Next Generation NCLEX (NGN), with its emphasis on clinical judgment, requires more than just rote memorization of facts and procedures. It demands that you integrate your nursing knowledge, critical thinking skills, and clinical reasoning abilities to make sound decisions in complex patient scenarios. Think of it as bridging the gap between theory and practice, demonstrating your readiness to provide safe and effective care as a licensed registered nurse. Imagine yourself standing at the bedside of a patient, armed with your nursing knowledge and a stethoscope in hand. You've gathered assessment data, analyzed the cues, and formulated a plan of care. Now it's time to put your knowledge into action, making decisions that will impact your patient's well-being. This is where clinical judgment comes into play, guiding your actions and ensuring optimal outcomes. The NGN's innovative item formats, such as case studies, multiple response items, and bowtie questions, are designed to assess your ability to apply your knowledge in real-world contexts. They challenge you to think critically, prioritize care, and make informed decisions based on the unique needs of each patient. No longer is it sufficient to simply regurgitate facts. You must demonstrate your ability to connect the dots, interpret data, and make sound judgments that reflect your understanding of the nursing process. The essence of nursing. The NCLEX RN 2025 syllabus is structured around the client needs framework, prioritizing patient well-being. This framework guides your exam preparation, covering essential content areas for safe nursing practice. It builds your clinical judgment and decision-making skills. The client needs framework includes 8 domains, each addressing vital aspects of patient care. These domains reflect the multifaceted role of the registered nurse in today's healthcare landscape. Section 2. Management of care, orchestrating optimal patient outcomes. Management of care focuses on coordinating and overseeing safe, effective nursing care. Imagine yourself as the conductor of an orchestra, ensuring harmony. As a nurse, you'll orchestrate various aspects of patient care for optimal outcomes. This includes legal principles, task delegation, and interdisciplinary collaboration. Section 3. Safety and infection control. Guardians of patient well-being. Safety and infection control is about protecting patients from harm and preventing infection spread. Imagine yourself as a guardian, creating a safe environment for recovery. This includes preventing falls, medication errors, and responding to emergencies. Be vigilant in identifying hazards and mitigating risks. Implement precautions like bed alarms for fall risks. Infection control is critical. Adhere to protocols to prevent healthcare-associated infections. Master hand hygiene, PPE use, and isolation precautions. Emergency preparedness ensures patient safety. Respond swiftly to emergencies like cardiac arrest. Perform life-saving interventions such as CPR and defibrillation. Section 4. Health promotion and maintenance, empowering patients across the lifespan. Imagine yourself as a health coach, guiding your patients towards making positive lifestyle choices and preventing illness. Growth and development are key concepts within this domain, as you'll need to understand the physical, cognitive, and psychosocial changes that occur throughout the lifespan. From assessing the developmental milestones of a newborn to providing age-appropriate health education to an elderly patient, your knowledge of growth and development will guide your interventions. Prenatal care, postpartum care, and newborn care are also essential components of this domain, as you'll be responsible for guiding families through the joys and challenges of bringing a new life into the world. From educating expectant mothers about healthy pregnancy habits to supporting new parents in caring for their newborns, your role in these areas is both rewarding and demanding. Screening and immunizations are crucial preventive measures that fall under this domain. You'll need to be familiar with recommended screening guidelines for various diseases and conditions, as well as the immunization schedules for children and adults. Educating patients about the importance of screenings and immunizations and addressing any concerns they may have is paramount in promoting public health. Section 5. Psychosocial integrity. Caring for the mind, body, and spirit. Psychosocial integrity emphasizes holistic care, addressing mental, emotional, and social well-being. Be a compassionate listener, supporting patients through emotional challenges. Understand mental health disorders and therapeutic communication. Crisis intervention and recognizing abuse are crucial skills. Provide a safe space for patients to disclose abuse. Support patients through grief and loss, helping them cope. Section 6. Basic care and comfort, foundational elements of nursing practice. Basic care and comfort is essential for promoting physical and emotional well-being in patients. These interventions are the foundation of all other care aspects. Meeting basic needs supports healing and overall well-being. This includes mobility, hygiene, nutrition, and pain management. Section 7. Pharmacological and parenteral therapies. Navigating the world of medications. Pharmacological and parenteral therapies delve into the vast world of medications. As a nurse, you'll administer medications safely, monitor effects, and educate patients. You'll need a strong foundation in pharmacology, understanding classifications, dosages, and side effects. Proficiency in various administration routes, including IV therapy, is essential. Total parenteral nutrition provides complete nutrition for patients unable to eat. Section 8. Reduction of risk potential. Anticipating and mitigating complications. Reduction of risk potential is crucial for preventing complications and promoting optimal patient outcomes. Think of yourself as a detective, searching for clues and implementing interventions to safeguard patients. Understanding pathophysiology helps anticipate complications and take proactive steps. Diagnostic tests identify risks and guide treatment decisions. Monitoring patients for changes is fundamental in nursing care. Section 1. Embracing the evolution beyond multiple choice. The Next Generation NCLEX moves beyond traditional multiple choice, embracing innovative item types that mirror real-world nursing complexities. It challenges you to think critically, analyze data, and make informed decisions. Engage with patient scenarios, prioritize interventions, and evaluate outcomes. This is the essence of the NGN's commitment to assessing clinical judgment. Section 2. Unpacking case studies, your clinical playground. Case studies are a cornerstone of the NGN, providing a virtual playground to demonstrate your clinical judgment. Step into a simulated environment with realistic patient scenarios, detailed medical histories, and vital signs. Each case study is a chapter in a patient's care journey, requiring assessment, planning, intervention, and evaluation. Showcase your ability to connect the dots, identify patterns, and make informed decisions. Analyze patient data, interpret lab findings, and consider potential complications. Prioritize interventions, anticipate responses, and modify care plans based on new information. Questions are interconnected, mirroring the dynamic nature of patient care. Adopt a systematic approach to excel in case studies. Review patient information, highlight key data points, and identify red flags. Analyze each question, breaking it down into core components. Determine the specific task or decision being asked of you. Identify relevant information from the case study. Demonstrate critical thinking, apply nursing knowledge, and make sound clinical judgments. Section 3. Mastering the Matrix Enhanced Multiple Response Items. The NGN introduces enhanced multiple response items, often in a matrix format. Match patient scenarios with appropriate responses, demonstrating critical thinking. This format challenges you to apply knowledge across clinical situations, differentiate between patient presentations, and prioritize interventions. Mastering matrix questions requires strong nursing knowledge and critical thinking skills. Section 1. Navigating the Sea of Knowledge. Key study domains. As you embark on your NCLEX RN 2025 journey, focus on key study domains to optimize your efforts. These domains are the pillars of nursing practice, essential for safe and effective patient care. Mastering them equips you to excel in the NGN exam and as a registered nurse. The NCLEX RN 2025 syllabus highlights key domains like medical surgical, maternal newborn, mental health, community health, and leadership. Prioritize your study based on strengths, weaknesses, and exam weightage. Medical surgical nursing is a significant portion, covering acute and chronic conditions. Understanding pathophysiology, pharmacology, and interventions is crucial. Section 2. Medical surgical nursing, the cornerstone of practice. Medical surgical nursing forms the foundation of your nursing practice. It encompasses a wide range of conditions, requiring a comprehensive understanding of pathophysiology, pharmacology, and nursing interventions. Imagine stepping onto a busy unit, encountering patients with acute and chronic diseases. You'll assess patients, interpret tests, and collaborate with the team to develop care plans. Section 3. Specialty areas, expanding your horizons. Expanding your knowledge to specialty areas enhances your clinical judgment and prepares you for diverse challenges. Think of these areas as branches extending from your medical surgical foundation. Maternal, newborn, and pediatric nursing involves caring for women and children. This requires understanding growth, development, and family-centered care. Mental health nursing explores mental health disorders and therapeutic interventions. You'll need a strong foundation in psychology and communication. As you gear up for the NCLEX RN 2025, remember that rote memorization won't suffice. The NGN assesses your clinical judgment, your ability to think critically, prioritize, and make sound decisions. Think of yourself as a detective, piecing together clues from patient data. Prioritization is paramount in nursing. The NGN tests your ability to determine which patient requires immediate intervention. Embrace the ABCs: airway, breathing, and circulation. A patient with breathing difficulty takes precedence over one with a stable ankle sprain. Clinical judgment goes beyond algorithms or protocols. It involves understanding the nursing process, pathophysiology, and pharmacology. Imagine caring for a diabetic patient with hypoglycemia. Assess the patient's ability to swallow safely before administering glucose. Sharpen your clinical judgment by engaging in active learning. Understand the why behind nursing interventions. Ask questions like, why is this medication being administered? This understanding empowers you to make sound clinical judgments. Navigating the NGN requires more than just knowledge. It demands a strategic approach to learning. Utilize NCLEX RN review books and online courses for comprehensive content review, practice questions, and detailed explanations. Practice extensively with NGN-style questions to master the exam's format and timing. As we conclude this comprehensive syllabus guide, remember that the NCLEX RN 2025, with its emphasis on clinical judgment, is not merely an exam to pass, but a journey that transforms you into a competent and compassionate registered nurse. The knowledge, skills, and critical thinking abilities you cultivate during your preparation will serve as the foundation for your nursing career, empowering you to provide safe and effective care to patients across all healthcare settings. The NGN's focus on clinical judgment reflects the evolving healthcare landscape, where nurses are increasingly required to make complex decisions in real time, often with limited resources and under pressure. The case-based scenarios, multiple response items, and innovative formats like Bowtie and trend questions are not designed to trick you, but to assess your ability to think on your feet, prioritize effectively, and apply your knowledge to real-world situations. Embrace this journey with enthusiasm and dedication, knowing that the skills you develop will not only help you pass the NCLEX RN, but will also shape you into a confident and compassionate healthcare professional. Seek out opportunities to apply your knowledge in clinical settings, engage in thoughtful discussions with your peers and mentors, and never underestimate the power of practice and perseverance. Remember that success on the NCLEX RN 2025 is not a matter of luck, but a testament to your hard work, dedication, and unwavering belief in your abilities. Approach your preparation with a positive mindset, knowing that you have the knowledge, skills, and determination to excel. Believe in yourself, trust in your training, and never underestimate the power of a well-prepared mind. As you take each step closer to your dream of becoming a registered nurse, remember that you are not alone on this journey. Surround yourself with supportive peers, mentors, and educators who can provide guidance, encouragement, and a listening ear. Celebrate your successes, learn from your setbacks, and never hesitate to ask for help when you need it. The NCLEX RN 2025 awaits, and with it, the opportunity to embark on a rewarding and fulfilling career in nursing. Embrace the challenge, stay focused on your goals, and never lose sight of the reason you chose this path: to make a difference in the lives of others through compassionate and skilled nursing care. You've got this.